sales rock star, you have to be an information gatherer, not an information giver. See, what we're going to do is we're actually going to listen to a sales call that happened about a decade ago where we're going to focus on the discovery process, the fact find. In this phone call that we're going to listen to, I'm going to stop it at certain points so we can discuss exactly what's going on during the call and also what's going on in my mind as I'm talking to this individual on the phone. You'll see as we jump into this phone call, this lady becomes adversarial to me. She all of a sudden stops me and tries taking control of the phone call. And you're going to see how I deflect from her trying to take control of the phone call and how I take control of this phone call and how I gather the facts. The fact find is about 10 minutes long. The longer that your fact find is, the more information you're able to gather in order to be able to find out exactly what the problem is, isolate it so that you are 100% sure that you have the solution. On every phone call that I had with somebody, I made sure that I was absolutely convinced, I had absolute certainty that I had a chance to go ahead and sell this person. That meant that I might have to ask some more questions in order to make sure that I was absolutely certain that I could sell the individual. I did not want to waste my time, and I didn't want to waste their time as well. So as we listen to this phone call, I want to make it very clear, when it comes down to your fact find, your discovery process, you want your discovery fact find process to be anywhere between 7 minutes to about 10 minutes. Anything less than that, unfortunately, you're jumping into a presentation that you're not 100% sure if this is somebody that you can help out. You want to make sure that when you're talking to somebody and you're actually presenting to them, that you have the opportunity to close them. You have to look at your phone call from a point A to a point B. In order for me to see the end, the point B, the straight line, I have to make sure that my fact find and my discovery is so solid that if this person tries to back out at any point during the phone call, I can come back here to my discovery, to my fact find, and point out to them that this was actually their decision to move over here. It wasn't my decision, based on the facts that I was able to obtain and gather. So let's jump into this phone call right now so that we can go over it so you can actually see exactly what a really good fact find should look like in phone sales. Thanks for calling the Medicare Medigap hotline. My name is Greg.
Hi, this is Ellie. I have someone on the line who is interested in learning more about Medicare SUPs. Can you help them?
Oh, absolutely. Thank you so much, Ellie. Good afternoon. I'm going to stop it right here. If you're having somebody send over a call to you, somebody's transferring a phone call to you, build up the person that that's transferring it to you. I've heard so many phone calls where sales agents will get a phone call, a transfer from somebody else, and they'll just move right into talking to the other person. Stop. Acknowledge the person and the hard work that they did to actually get you this person on the phone in order for you to talk to them. Think of it like the Olympics, and you're in a relay race, and they're running around and they're handing the baton to you. You've got somebody that's transferring a call to you right now. Make sure that the baton, the handoff, is smooth. You do that by acknowledging the person that actually sent over this phone call to you. So you can hear in this phone call, I thank Ellie for going ahead and sending me this individual for me to help. Am I speaking with Bob?
No, you're talking with his wife, Joanna.
Okay, Joanna.
Let me ask you this before we go too far. Do y'all also work with, I think it's Baylor, Scott and White?
With which one?
As a supplement, Baylor, Scott and White.
Yeah, I've been in the business for over 10 years. I'm actually one of the leading experts in the Medicare supplement industry. Those things with Baylor Scott are actually plans that are instead of original Medicare for the insurance. So let me ask you a couple of questions. You said. So let me stop here. She asked me a direct question. Do you work with Baylor Scott and White? Okay. Did I ever answer that? The answer is no. I deflected. I said, no, those are those alternative plans to Medicare. And then I went into my fact find gathering process, because right now I don't know if I can even help this individual out. I don't know what is their situation. I don't know what the problem is. So I'm not going to sit here and spend all this time talking about this company when I don't know if I can even help them out. So I need to get as quickly as possible into my discovery process. I didn't bash this company. I didn't say anything bad about them, because this might be the right solution for them. I don't know. I just went ahead and stated the facts. Those are alternative plans to original Medicare, but let's find out a little bit more about your situation. I went ahead and I deflected, and I got right into the discovery process with this individual.
You said your first name was Joanne, correct?
Yes.
Okay, Joanne. And just so that you and I are kind of on the same page, it looks like I have you located at, is that right?
Correct.
And that's in excuse me on this one, 𝘥cie, Texas, and zip code I have a 751.
Let me stop it right here. I knew right here in this phone call, we're a minute 14 seconds into this phone call, I knew that I was closing Joanne. How did I know that? Based on her laughter. She came in the phone call a little aggressive, not too bad, but she came away. Let me stop you right there. Do you work with this company? And how I answered that, and I deflected around it, and then went right into my process, which my first process is this. You have to find out where they live. As an insurance agent, you do not have the right, let me repeat that, you do not have the right to earn their business if you don't know where they live. That's the first thing that you have to find out. The first thing that you have to go ahead and you have to validate. So here I have the information in front of me. I have the address. I have the city and the state. I'm making sure that I have the correct information on my end of it. She's acknowledged it. I had a problem stating the city. I laughed a little bit, and guess what Joanne did? She started laughing as well. I knew that I broke the ice. I knew that if there was anything here, I was going to get the sale if I followed my process. And so here I'm following my process. The first thing in Medicare sales is to make sure that you know exactly where this individual lives, and then find out exactly what their birthday is, what their date of birth is, and then find out what their Medicare status is. So those are the three things on every phone call that I would look at, is where they live, date of birth, and what their Medicare status is. Are they going on to Medicare for the first time if they're turning 65, or are they already on Medicare early because of a disability? That let me know, okay, now I can continue asking some questions. But those are the first three questions I would ask on every single phone call, was where they live, zip code, date of birth, and what their Medicare status is. So let's continue with this phone call.
5165, is that correct?
That's correct.
Okay, and I'm seeing that Bob's actually turning 65 here in March, next month here.
Yes.
Is that correct?
March 9th.
March 9th. Okay, so let me ask you this question. You said his first name is Joanne, right?
Yes.
Okay, let me ask you this. Is Bob still working right now, or is he retired?
No, he's retired.
Retired, okay. And has he been on Medicare early because of a disability at all for any reason? Okay,
no,
so
he was on. He started receiving his Social Security at 62.
okay, that's fine. So then he should have his red, white, and blue card then in his hand right now.
So I'm going to stop it right here. This individual is turning 65. I just asked if they were drawing Social Security. She just told me that he started drawing it at 62. So here in the United States at this present time, in 2021, is that an individual can start drawing Social Security early at the age of 62. So at the age of 62, that tells me a couple of things by her telling me that her husband Bob has been drawing Social Security since 62. It tells me that there could be an income issue here. Because if somebody is drawing Social Security early before they turn 65 at this time, is that they would be penalized. They would get less money by taking it early. Now in 2021, it's over 66. That's the full retirement age. So anybody taking their Social Security payments early is getting less over time. So it tells me that there might be an income issue there. So I've kind of processed that in my mind that, you know what, they were looking at an alternative plan to Medicare. They start drawing Social Security early at the age of 62, so there might be an income issue here, but again, I'm not prejudging this phone call. I'm just gathering the facts. As a sales rock star, you have to be able to gather the facts and let the facts determine where you're going with the phone call, not prejudge it. So the other thing that this is telling me as well is that if they were drawing Social Security at 62, that means that he should have his red, white, and blue Medicare card in his hands right now because he was actually turning 65 the next month. So he should have his Medicare card there because he was drawing Social Security early. So if you're drawing Social Security early, you're automatically enrolled into Medicare 4 months prior to your 65th birthday. So 4 months prior to your 65th birthday, if you are drawing Social Security will automatically mail out your Medicare card. So now I know he's been drawing Social Security since 62. He turns 65 next month, so he should have his red, white, and blue Medicare card right in his hands. Why don't I ask them right now if they have their Medicare card right now in their hands? And that's what I do next.
And right now,
we have not received it. We have been waiting. In fact, we called them last week and said we have not received their card, and so they're sending another one. They said they sent it out in October, but we never received it. So in fact, they're also sending what's the card, but they're sending us a letter next week saying that we are going to be receiving the card, I guess, and with the Medicare.
I'm going to stop it right here because I've used this phone call during trainings. I want you to rewind this just a little bit and hear what Joanne just told me. She said something. I've rewound this phone call and asked individuals to listen to it, and very few have been able to pick it up. She says something that's really, really important. And this is why, as a sales rock star, you have to be listening very intently to everything that's going on in their world. Stop thinking about your world. Start getting in their world. Get in the virtual world of them. Start listening to them. She says these magic words, I guess. They're telling us that they're sending this out, I guess. So here, what's happened is this. Joanne and Bob did not get their Medicare card in the mail automatically, which they were supposed to. They call Social Security and they ask them, well, we never got our Medicare card. And so Social Security says, no, we sent it out to you. Well, they obviously don't have it, so they don't know whether to trust whether it was even sent out. Now Social Security is saying, hey, we're sending you out a letter. She's like, they told us they sent us a card. We never got it. Now they're telling us they're sending us a letter. Maybe we won't get that. I guess they're going to send it out. I don't know. This was my cue right here. I heard it the very first phone call I had with this individual. I knew right then it was time for me to step up and be an absolute sales rock star to the person on the other end of the phone. They deserved the very best from me. And for me, I had to step up and let them know that, you know what? You got the right person on the phone. You got the right person to help you out. This was my time to step up because they didn't know if Social Security, which they felt was the highest level, was actually going to be able to do it for them. Now was my time to say, you know what? You're in the right hands. So listen to what I do.
Medicare number on it, but right at the present time, we don't have it.
Yep, and that's right, because what happens, Joanne, is that whenever somebody is drawing Social Security, which Bob was doing at 62 years old, is that whenever you're drawing Social Security, you're actually already enrolled into Medicare for the first day of your birth month. So Social Security Medicare was correct about that. They mail them out usually about 3.5 months before somebody's start date, and you and I both know with the U.S. mail, sometimes there's a little boo-boo, and sometimes it gets lost or something like that, so there's nothing to worry about. Bob will start actually tomorrow, and I can actually give you all of his information because I'm linked up directly through Medicare and Social Security, so I'll be able to tell you that. But let me ask you this question. Right now, you know, it sounds like, and tell me if I'm wrong, are you doing all the research for him? Are you helping him with this, or is he?
Yes.
Okay, you're doing okay.
So see what I'm doing right now on the phone call is I'm making sure that I'm dealing with the decision maker. Now I thought it sounded like Joanne was the decision maker. But again, I don't want to just assume it. I want to make sure that I'm talking to the decision maker so I'm not wasting my time if she is not the decision maker. You've also noticed during this phone call, and I've talked about this in previous videos, is that the first name is the sweetest sound to the human ear. You've heard during this phone call me mention Joanne and Bob several times during this phone call because each time I'm doing it is I'm creating a relationship with this couple. I'm making sure that they see me as a friend and as someone that actually cares about them, and this is not just a transaction. So each time I'm saying their names, it's actually pulling them into myself as a friend and not just a transactional salesperson.
Okay. And let me ask you, has anybody been able to explain Medicare and supplemental plans in a way that you can actually understand that makes sense?
No. Myself, I'm on Medicare, and I have a supplement right now, Humana, and but I've never really understood all the network and all the other, that I have.
Beautiful.
But
let me stop you right here. You probably just heard me say beautiful. I didn't mean for that to come out. I was actually supposed to keep that in my mind. She just told me that she has a supplement plan through Humana, but she doesn't understand all the networks that are involved with it. Well, I know that she has a Medicare Advantage plan because she's talking about networks with Humana. If she had Original Medicare as her insurance, there's no networks with Original Medicare. So as she's saying this, I'm saying to myself, beautiful. I'm going to be able to help her understand what she has, as well as help her understand what her husband Bob is going to need. So I was saying that in my mind, beautiful. This is making it easy on me because I understand now exactly where I'm taking this phone call because of how I'm letting her talk. I'm directing the phone call. So that word beautiful was actually supposed to stay in my mind, but it actually came out verbally.
Well, here's God was looking out for you guys by putting you in touch with me, because what I do is I make the person I'm talking to a Medicare expert just like me. In the next 10 minutes, you'll actually know exactly what I know from 10 years of experience and make it simple to understand, because I've always had this motto that Medicare is simple as 1, 2, 3, and I break it down into 3 components so that you can actually understand it, and by understanding it, you'll have the best insurance ever made available to you in the world, and Bob will have financial security for his health care needs for the rest of his life by working with me. But right now, are you...
Whoa, let me stop this phone call. Bob's going to have financial security for the rest of his life by working with who? By working with me. See, I'm now subliminally telling Joanne that her and Bob are going to use me. He's going to have financial security for the rest of his life by working with me. See, these subliminal things that you're telling them during the conversation is starting to draw them into you as the Medicare expert, as the one that's going to help them with their problem, with their issue. So here I've used their first name throughout this phone call so far, and I'm letting them know that they're okay. They're going to be fine. They found the person that is going to help them out. They found their rock star.
Now, are you 65 yet, or are you? Are you?
I'm 67.
So you're 60s. Okay,
yeah,
67. Okay, and then...
Right now, I'm presently on Humana as my supplement.
Right, okay.
He's got 3 doctors that we need to find an insurance plan that covers all 3 doctors that they're involved in. And I didn't know that Baylor, Scott & White, I thought they also had a supplement plan, but they don't?
No, they don't. And... Also, I'm gonna blow your mind right now, so hopefully you're sitting down, okay? You don't have a supplement plan, okay? You have something that's actually, instead of Medicare, known as an 𝘄𝗶𝗹𝗶𝗶 Medicare Advantage plan. A lot of people don't understand how this all actually works, and now you will know this stuff really, really well. So do me a favor, grab a pen and a paper. I'm going to have you jot some stuff down just like I'm sitting right there in your living room with you and explain it to you. And I actually, believe it or not, I do this exercise with you. So as you're writing it on your paper, I'm also writing it on my paper as well. So just let me know whenever you have your pen and paper handy. I'm gonna start having you write a couple things down.
Okay, hold on just a moment.
Take your time.
So the question is right now, I'm 6 minutes into the phone call. Do I have enough information right now to be able to sell Joanne and Bob any type of supplemental insurance, whether it be a supplement or it be a Medicare Advantage plan? I'm going to let you decide. What is it? See, this is where sales agents make a big mistake. They get so excited because they think, I've got somebody now that I can actually close. And they're now thinking about the sale. They're thinking, I've got enough information. Let me ask you this question. Do I know what Bob has right now currently for his health insurance? No, I don't. Do I know how much he's paying right now for his current insurance? No, I don't. Those are really important things that I need to know in order to be absolutely certain that I can go ahead and sell something to Joanne and Bob. See, if I made the mistake right now and jumped into my presentation, that could come back and bite me. Because what about if they were on some form of insurance that they didn't even need my help? You have to find out what they currently have right now for their insurance, what they're paying for their insurance. So you have to find out where they've been so that you can tell them actually where to go. So right now what I've done is this. I think I've have enough information at least to start moving this conversation closer to a presentation. But I know that I don't have everything yet. So I've broken it up right now. I've asked her to go get a pen and paper so that she can start jotting this down. In Medicare sales, it's so important that you do what I call the pen and paper approach, is you have the other person go grab a pen and a piece of paper so that they can follow along with your presentation. That allows them, first and foremost, to commit to you right away. When they go grab a pen and a paper, they're now committing to you. So now I'm going to go ahead and ask her some more questions to be 100% sure and absolutely certain that I can help them out with their insurance needs. So let me ask you, so far in this conversation, have you picked up the biggest problem that they're facing right now? I'm going to tell you that at the end of this phone call, what the biggest problem Bob and Joanne are facing right now when it comes to their health insurance. Stay tuned.
Okay, I got a pencil.
Okay. Perfect. Okay. I wish I had talked to you a couple of weeks ago because I would have actually been able to help you out a little bit as well, and I'll explain that to you in a second. But we'll talk about Bob right now. But then, if I can help you guys out, I'll always be the person you can pick up the phone and talk to going forward. But my first name,
Yeah.
Yep. My first name is Greg, G-R-E-G. My last name is Gurbikian. It's a mouthful, so I'm gonna spell it for you. G as in girl, U-R, B as in boy, I-K, I-A-N as in Nancy. Gurbikian. Okay. And my toll-free number comes right to me is 844 427 7526. And my personal extension is 102.
102. I got it.
Okay, and then write down the name of my company because we're the leading company in the United States when it comes to the supplemental plans of Medicare. The name of my company is called Medicare, Medigap, M-E-D-I-G-A-P, Medigap. Direct, D-I-R-E-C-T, direct. And so what we do is we actually go directly to the insurance companies for you. So we are all the insurance companies, which makes it nice is that I don't endorse any one company. I actually look out for what's best for you guys, and I explain it so that you actually understand how this stuff works. So before I have you write down something, let me ask you, up until say tomorrow when Bob's Medicare is due to start, is he covered under some form of health insurance right now?
At the present time, he is on the Obama plan. It's Blue Cross Blue Shield. But
Blue Cross.
that goes only until the 8th, and then it stops.
Right, okay. And then, if you don't mind me asking you, what are you guys paying a month right now for that Obamacare plan?
About $92 a month.
$92 a month. Okay, $92 a month. And you know what?
I'm going to stop it right here. You hear me repeating the $92 a month, $92 a month a couple of times. So they're getting a subsidy from the federal government, so I know there's probably an income issue right now because they're only paying $92 a month, okay? But she mentioned something to me earlier. Bob has 3 doctors that he needs to be sure that he can see. So I'm starting to think to myself right now, what's the best option for Bob? So Bob is paying $92 a month. He's got an Obamacare plan that he has co-pays for when he goes to doctors. He has 3 doctors. I'm looking at the Medicare supplement plans right now, and the supplement plans about $117, $115 a month for the supplement plan. So I'm starting to say in my mind, he's paying $92 a month, $92 a month. The supplement plan is $115 a month. There's no co-pays with that. He can go anywhere. He's got a problem right now where he's got 3 doctors that he's trying to go ahead and make sure that they're all in the network. What else do I know so far in this phone call? I know that Joanne has probably already checked with Humana because that's who she has for insurance. And Humana probably doesn't have all of his doctors in the network. Why do I feel that way? Because she wouldn't be on the phone with me. She would probably be signing him up with Humana. So I know she's already probably looked into this. So now I'm starting to ask myself, can Bob afford $115 a month versus $92 a month? So that's why I keep saying $92 a month, $92 a month. I could have gone further into their financial history, but I looked at it from this standpoint. That's $25 more than he's paying right now. This plan that I'm looking at has no co-pays to it. So there's no co-pays for doctors. He's got 3 doctors that he's seeing. He's actually going to save money. And the biggest problem that they have, I told you I was going to let you know, the biggest problem that they have is that they need to make sure that whatever plan they're on, all 3 doctors accept the insurance. So I know that if Medicare is his primary insurance and he gets a supplement plan, he doesn't have to worry about networks. All 3 of his doctors will accept the supplement plan with his Medicare card. So I decide to move forward with the conversation.
What type of deductible he has with that plan?
No, I don't. I'm sorry.
It's got to be. Yeah, no, that's okay. It's got to be high. It's got to be at least probably $3,500 or $5,000 for that deductible on that plan because the Obamacare plans are really, really high. So, yep.
Stop it right here. These are key things in this phone call that if I don't stop and explain to you, we might just go right past it and you might not understand this. So I asked them what their deductible is. She says she doesn't know. I know their deductible, this was a decade ago, was pretty high. So I tell them, it sounds like your deductible is $3,500, $5,000. It's really, really high. She laughs and goes, yeah, I know. Well, guess what the deductible on the supplement plan that I was offering them? It was $140. So by me going ahead and telling them, you know what, your deductible right now is $3,500, $5,000, and she's agreeing with me. Yeah, I know it's really, really high, Greg. Later in the conversation, she ends up telling me later during the presentation that yes, they've had some very high out-of-pocket expenses with their current insurance plan. They hate their current insurance plan. One of the doctors that he wanted to go see, she tells me a very sad story that he had cancer under his current insurance plan. And you know what? One of the doctors that they had to go see, because that was the only one in the network, actually messed him up. And it was a really sad story. So going forward right now, I know two things. I've already implanted that she's got a high deductible, $3,500, $5,000. I have something that's $140 deductible. They're paying $92 a month. I've got something that's about $115 a month with absolutely no copays, and all the doctors accept it. So now you can see all these facts that I've gathered right now have put me in a position to not only be able to close and sell them something, but more importantly, I'm helping them. I'm creating a relationship with them. They feel like they can trust me, and guess what? They can trust me because I care about them. I'm using first names throughout the entire phone call.
Yep. So okay. So you're gonna love this here in the next little bit. Let me ask you: Has Bob used any form of tobacco at all in the last 12 months?
No.
Perfect. Good for him. Okay. Good. Okay. So I'm glad that you and I both got in touch with each other because, as I mentioned to you, you're going to understand this stuff right now, and a little bit of this is going to blow your mind. So what I want you to do is this: I want you to write a number 1 on your piece of paper.
So now we're about 10 minutes. Now I'm about to jump into the presentation. The fact find, the discovery process is now over. I feel like I have enough information now to be able to point Joanne and Bob in the right direction. See, I could always ask some more questions, but I feel like I have enough right now to help them along their journey, and I feel like they trust me right now. We've created a connection. There's rapport. There's common ground. They now feel that I'm not just some insurance agent trying to sell them something. I'm actually now a friend. Joanne and Bob now trust me. Listen to this video again, watch it again, and see this is how your fact find should be. You should care about the other person so much on the other end of the phone. Address them by their first names throughout the entire phone call. Make sure that you're an information gatherer and not an information giver. These are the steps that will ensure that you will be an absolute sales rock star. If you treat every phone call just like this, where you make it a point to gather as much information and you start formulating where you're going to take this phone call based on facts, not assumptions, you will close more sales and you will make more money by doing this. And more importantly, you're going to help a lot more people. Go out there and be an absolute sales rock star and make sure that your fact find, your discovery are so solid that you have absolute certainty of exactly where you're going to go in that sales phone call.